and just do that provocation test that we were doing before. If I'm more interested in just mobilizing one side or oscillating one side, let's just say we identify this as left pelvic girdle pain. You know, this hand could just be a stabilizer where this one's then doing the oscillation out. Or I could just be doing both at the same time, just like the distraction test, okay? What I was saying was, instead of this creating a force at the same time like this, all I did was kind of lock in with this one. So then all I was really doing was, the motion was more out of my left hand. But medial inward rotation. So for the in-flare technique, this is, again, we showed you last time how we can do a mobility kind of test here. And we took our forearm muscles, and all we did was we applied that in-flare motion, just converting that into the treatment now. It could be an oscillation, it could be a sustained hold. Muscle energy technique or exercise for anterior posterior rotations. Muscle energy for outflaring and inflaring. And then you also got a manual to outflare it and inflare it. Move the ilium in the sagittal and the transverse plane. Yay! Yay! We need to move the sacrum now. Exercise perspective in the sagittal plane. So we're talking about nutation and counter nutation of the sacrum. What muscles might be in position to pull the sacrum anteriorly and pull it posteriorly in the sagittal plane? So the short answer is not many, actually. So we're not going to show you any exercise-based ones. For sagittal plane, transverse plane, or the piriformis, because where's the piriformis attached? Right in here. And so when it contracts, which way can we get that sacrum to move? Are we going to rotate it more forward or more backwards when that guy contracts there? Anteriorly. It's attached anteriorly. It's going to pull it anteriorly. It's causing, you know, a twist in motion there, transverse plane motion. And the multifidus posteriorly, because it's big and thick back there. We think of the multifidus as a contralateral rotator of the lumbar spine on the sacrum, but in its pull, it's going to transversely rotate that sacrum as well. Sagittal plane movements, we're going to do two separate ways, okay? Manually, we can do things like take our sacral rocking technique and just convert that into the treatment. It could be a back and forth oscillation, just like we assessed it, or it could be a one-sided affair. So if my goal is to create extension or counter nutation of the sacrum, then my pressure only needs to be on the inferior portion of the sacrum. If I'm interested in nutation, I can just oscillate on the base of the sacrum. I can change my hand contacts. If I don't like this, I could change my hand contacts now, because now that I'm not going back and forth, I can stay in one place and start to oscillate there, and I can oscillate here for counter nutation. The other thing I can start to do with this is incorporate the person's breathing. So for nutation, so for sacral flexion, your hand would be on the base of the sacrum, and then you can ask the person to take a deep breath in, and when they let it out, what am I going to do? I can take the sacrum with their exhalation into nutation by putting that, you know, applying that posterior to anterior force. Then, at that end range, I can oscillate at end range while they're exhaled for a moment. Or the other thing I can do is I can hold it there while they take a what? Deep breath in. Because when they take a deep breath in, what's the lumbar spine going to do? And when the lumbar spine does that, what is the sacrum going to want to do? The lumbar spine is going to want to flex because they're inhaling. So the lumbar spine is going to want to flex. So the sacrum is going to want to counter nutate, come back up. But what am I doing? I'm stopping it. So you almost use the force of their breathing as the mobilization force. They're taking a deep breath in. The sacrum's trying to counter nutate, but you're holding that in position so they get that stretch there. You can do the exact same thing except opposite on the base of the sacrum. As they take a deep breath in, I can apply more force, because as you're taking a deep breath in, that sacrum's going to counter nutate, so I can be right over the top with my hand to take it with them. Now that they breathe in, I use that force of their breathing to get more counter nutation. And then conversely, when they breathe out, and their sacrum wants to go into flexion, into nutation, I can hold that position. So again, sacrum anterior, posterior, or sacrum in the sagittal plane, okay? I can find his PSISs, come to the center. That's about the level of S2, okay? So I want to be just slightly above that, because I really want to be right on the base of that sacrum, so between S1 and S2. And all I can do right there is if I wanted to do sacral nutation, sacral flexion, I can just oscillate that. Or I could mobilize it. Then when we're talking about the breathing, go ahead, take a deep breath in for me. And notice, when he takes a deep breath in, what happens to my hand? Which way does it move? It moves this way, because his sacrum's going into counter nutation. So as he counter nutation, now let it all the way out, nice and deep. Yep, let that breath all the way out. As his exhalation is creating sacral nutation, I would go ahead and try to get some of that force. Of course, as I'm doing that, his rectus spinae and multifidus are firing like crazy, not letting me do that. Take a deep breath in, take an exhalation all the way out. I would go with that motion as far as it would take me. Hold it there. Hold it there. Now take a really deep breath in. Hold that deep breath. Hold it. Hold it. Hold that breath. Hold it, and let it out. Don't ask your patients to hold their breath for too long. And get kind of a sustained hold there for like maybe 2, 3, 5 seconds. We're not going to do a mobilization technique. We're going to ask the person to hold their breath for a minute while I hold this here. We can't do that. But you can ask the person to hold that breath for a moment. Okay. For counter nutation, all I'm going to do is place my hand near the apex of the sacrum, and so now the force is creating counter nutation of the sacrum. Go ahead, take a deep breath in for me. As he takes that deep breath in, I move with the sacrum to get more counter nutation. And go ahead, exhale all the way out for me. As he exhales, I try to maintain that counter-nutated position of his sacrum. It just gets that little bit more force into that counter-nutation. So you can do sacral rock-in as a technique. You can do one end or the other as a technique, okay? We already mentioned that we don't have direct muscles that we're going to contract to pull the sacrum anteriorly or posteriorly, but what physiologic motions can we have a person perform to create motion of the sacrum in the sagittal plane? Yeah, so just physiologic extension. So what right here could I have him do that would facilitate nutation or flexion? Yeah, so prone on elbows. Go ahead, come up on your elbows. Now this could be a sustained, I can keep him there. But what can I have him do? Go back down, up again. There you go. Now come back down, go back up. Go back down. So we know nutation of the sacrum is coupled with lumbar extension. So by facilitating lumbar extension, I'm getting that more passive motion, but the sacrum is going to move into nutation. Counter nutation, right? Counter nutation. Downward facing dog.
Child's pose.
Child's pose. Come down. So accentuating that lumbar flexion, that's going to create that counter nutation. Come on back up, flatten out that back, flatten out that back. There you go. Come down. Come on back up.
It's the only yoga dance ever had in his life.
Counter nutation, neutral. This could be done sitting up, accentuating the lordotic curve and then flattening out the lordotic curve, and the sacrum moving into nutation and counter nutation with those motions, okay? So while we don't have like an isometric exercise, we can move the spine physiologically and create that sacral nutation and counter nutation. The first manual technique, and really the only manual technique we're going to really show you for this, is to convert your sacral quadrant testing into the treatment, okay? But now instead of it just being for the assessment, I can just be on the quadrant and oscillate it as a treatment intervention, or create a mobilization, or, a prolonged hold mobilization. And I can do that for all 4 corners, okay? The exercise that we're gonna consider is we're gonna manipulate the contractions of the piriformis anteriorly and the multifidus posteriorly. So we'll get the person to contract their piriformis. And when they contract their piriformis, we're going to put their hip in a position where that line of pull is going to be nearly straight off of the sacrum itself. In this case, when I have the person contract their left piriformis, that piriformis should theoretically pull the sacrum this way. So into a right rotation. Sacrum rotating or to face to its right. This leg, piriformis, is pulling the sacrum anteriorly. Remember, the piriformis is right on that edge. So when the piriformis contracts, it's going to pull the sacrum with it. Conversely, on the other side, we're going to have the person contract their multifidus. When that multifidus contracts, it's going to pull the sacrum into the opposite direction. When you think about the piriformis and the position we want it in, we want the hip flexed to 90 degrees. I'm going to put the line of pull where the greater trochanter is, that superior lip of the greater trochanter where the piriformis attaches to, right in line with itself. So that way when the person contracts that piriformis, it is just going to pull the sacrum forward with it, okay? So we're gonna get these legs flexed up a little bit higher, okay? I mean, I can be on the sacrum to try to feel for some motion, but probably not gonna get a lot. And all I can have the person do is just ask the person, just lift your leg up like this into my arm as best you can. Go ahead and relax. A little bit softer. Hold on, let me move you. There you go, and relax. He is trying to abduct his hip, more so. I am just stabilizing that with my forearm. Could be my hand if I really wanted it to, but I just felt like in this case I could get my forearm and have him push into that for me. The piriformis now is right in line. As he's creating that abduction, the piriformis is firing, and because the piriformis, because the femur is not going to the sacrum, the piriformis says, okay, sacrum, you're going towards the femur for a degree or so. Then we go right into the multifidus contraction. So if he's laying on his right side, yes, left multifidus, I gotta do right rotation. So just push him the other way. Okay, so what's gonna happen is I'm gonna try to push you even further into this. You just don't let me move you. Hold on, let me move you. There you go. And if I'm a smart therapist, I would palpate the muscle to feel that. So I am trying to push him into further left rotation. That means he is right rotating against me. And I put him in maximal left rotation. I try to left rotate him even more, but he's gonna resist that. He's gonna go into right rotation. Go ahead, hold on, let me move. Contracting the left multifidus should induce, as a contralateral rotator, right rotation of the lumbar spine. Hold on, let me move you. Relax. Hold on, let me move you. Relax. Push through your pelvis too. Hold on, let me move you. There you go. Relax. Multifidus on this side is firing. His left multifidus is firing, so it's pulling that portion of the sacrum backwards. So getting that transverse plane motion. When I was talking before about which way does the sacrum rotate, to the right or left, we were talking about which way is the sacrum physically facing. And in that situation, what we're saying is ignore the fact that there's anything else attached to the sacrum other than there's just the sacrum by itself isolated in space. And if the I'm going to get this correct, the left multifidus fires, if the left multifidus fires, we're going to get left rotation of the sacrum. Right? The sacrum is facing left, oriented to where it was before. But if I put the spine back on top of it again, if those lumbar spines are there and the sacrum puts itself in a right-facing position, what rotation did I create of the spine?
There you go.
Right rotation. Because, again, if the left multifidus fires, the sacrum is rotating, its front face is facing left. But that means all the lumbar spine vertebrae above it are now in a right rotated position in relation to the sacrum. Always name spinal motion from what's happening on top to below. So by putting the sacrum in a position of left rotation, I created right rotation of the L5-S1 segment. Okay, so the multifidus is still a contralateral rotator. The anatomy didn't change. The biomechanics didn't change. We just changed the way we oriented ourselves and the way we were thinking about it. Okay? So I just don't want that lead to confusion later on.